Well, what about the diagnosis of prion disease? Well, I think this is where things have really changed. Firstly, we still use these three basic classical tests, but we have a much more refined understanding of them. We understand when to use them, when they're likely to be positive and what they mean. But no doubt the biggest advance has been using the amplification methods, because these are essentially specific tests. And the one test that's entered into routine clinical practice is the spinal fluid RT quick. It's highly sensitive and highly specific for sporadic CJD. In the UK, 94% of our sporadic cases have had a positive test, and we've never seen a positive test in anyone who does not have sporadic CJD. You can't extrapolate these figures necessarily to other countries or other laboratories, because different laboratories use different techniques and they use different test populations, but those are the figures in the UK. Now, interestingly, amplification techniques have been looked at in many other ways. They've been starting to be looked at in different tissues, which are more accessible, like blood, skin biopsies, urine, and brushings from the top of the nose. And interestingly as well, there have been refinements of these basic PMCA and RT quick methods to get rather better techniques. Nasal brushings are quite interesting in particular because if you stick the thing far enough up the nose, you get olfactory neurons. You get nerve cells that are outgrowths of the brain which deal with smell. And therefore you have a way of actually obtaining neural tissue without doing a brain biopsy. Now, I should say at this point that detection of abnormal protein in tissues outside the brain, like blood and urine, does not mean that these tissues are an infection risk in ordinary life. They aren't. And there's no evidence that these diseases are transmissible by ordinary, even intimate contact. Well, what about understanding the disease process? Well, I think the key developments have been understanding the structure of the protein and the detailed structure of the abnormal forms of these proteins. This has really been, to my mind, the key development area in understanding the disease.